Thank you for joining today. My name is Sissy Duncan. I am the owner of Hello Gorgeous Ink. I am a paramedical tattoo artist. So I have a really fun job. I get to create nipples on breast cancer survivors. I get to create nipples on people that are doing changes in from male to female or female to male. There's so many type of reasons why someone might need a 3D areola, and I get to bring that self-confidence to people. Have you guys heard of 3D areolas before? Anyone?
Yes.
Oh, they're probably on mute. So pretty much I just wanted to kind of just let you know that, hi, I'm here and I'd love to do 3D areolas on anyone that needs it. And the reason why I got into it is my aunt a couple years ago actually gotten breast cancer, and unfortunately she did pass away from it. So I never really got to do the areolas on her. But through her loss, this is a way of me getting to think of her and to kind of give back in my own way in her memory. And it's such a rewarding service. I love it so much to be able to be a part of someone's journey, to make them whole again, to make them look confident in the mirror as they look. Because you don't know you're missing nipples until you don't have them. It's crazy. I've done areolas where they're just the normal areolas, like the circles, and some people want hearts, some people want flowers, and but still like an areola. So that's fun. You can get creative with it. 3D areola is a tattoo. It's flat to the surface, but we do it in a way that it looks 3D, so it actually looks realistic. And this is a practice skin that I tattooed, and it is a tattooed areola. It's not finished. I actually didn't highlight this one, but this is what I had near me. But what I like about it is you can tell that it has its nipple mound, it has the areola, and it has the seams for your nipples, your highlight, your contour, and your Montgomery glands. Some people don't like the Montgomery glands, but I say get them because it makes it look more realistic. Because if you look at it, areola in your nipple, you do have Montgomery glands to them. So it just makes it look more realistic. And it may look flat when you look down, but when people look onward and when you look onward in that mirror, they look like nipples. I do get a lot of questions about unilateral versus bilateral. Like, what if I only need it on one? Can you make my nipple look like my nipple? And we can do that. We can match the color, the shape. We can try to mimic the texture. Like, again, it will be flat, but we'll make it look 3D. Unless you did a nipple mound, which the doctor would do during surgery, we would use that as the nipple and make it protrude out more, so it looks more 3D. So things like that. Bilateral is kind of fun because you can start fresh. If you don't want the same areolas that you had before, we can do a different style of areolas. We can, if you always wanted pink nipples, I can give you pink nipples. If you want more of a darker tone, we can do that as well. So that's also really fun. And it kind of helps take away from the scars that are left from your surgery if you did a flap from like your stomach or your buttocks. You know, sometimes you have the upper and lower scars. It kind of helps distract you from that. I also do scar camouflaging for those that are candidates. I can do that too, so I can kind of blend out the scars as well. And I also do 3D belly buttons as well. So I'm just going to throw that in there. Those are for people that get like tummy tucks and things like that. Nipple tattoos are less invasive than a nipple mound. So some people, to make it a little bit cost effective, instead of doing a nipple mound, they might just opt for 3D nipples tattoos, or they go ahead and do the nipple mound and we can do the tattoo over it. It kind of depends on what you're looking for. You do want to wait. The American Cancer Society recommends 3 to 4 months after surgery to get 3D areola tattoos, in case you guys are wondering, because you need time to heal properly. So that gives it enough time. But sometimes when you come in for your consultation, I might tell you, we need to wait another 2 months. Your scars are still a little too pink. Don't be upset. It's common. I always have you guys come in for a consultation just to make sure that we get you on the right timeline for your tattoos. Does it hurt? I'm trying to think of questions that you guys might be wondering and curious about the service. And feel free to stop me at any time if you feel like you have a question that comes to mind. I'm happy to answer them. Normally, it's not painful when you get 3D areolas because when you have the reconstruction of the breast, the sensations are not the same as they were before. So the pain is very minimal to none, but some people still feel some sensations, but I'd say about 90% of my patients do not have feeling in the area. So I don't usually put numbing cream, but if you do, I have what's called liquid duration and we can put that on to kind of help numb you. So it's less painful if you do feel it. We do highlight contouring. We do a couple different colors to create the areola color. I do some shadowing to make the nipple area pop and the Montgomery glands and the nipple seams. And I also like to add in highlight. So I usually like to pick like where I would like the light to hit. So you pick a light source and that's what really makes it look more realistic. Is so say this is your right breast. I would usually have the light source coming this way. So when you're looking at it, it looks more protruding versus this is this way and this light, the left one is coming from here. It doesn't match. So I usually do it like this. The light source coming that way, and that makes your areolas pop more. Or I might go straight down. It just depends on what I think might be best. You guys might have seen these rat cards, but you can see some of like actual patients. I don't know if you can really see it, but where they're. You can see the nipple mound in the lower left picture where there's nothing. That nipple mound is what the doctors did. And then the areola is what I did. And that's after her touch-up. And then this is another one. She wanted more of a minimal area. I keep losing my words. And minimal 3D areola and a larger nipple. So it's a little bit more pronounced the nipple area versus the other one. But there's many different ways that you can do it and create it. So when you come for your consultation, we figure that out together and I'll have you stand in the mirror and actually look at them. And I'm going to stand behind you because I want to see them as if I'm looking in the mirror to make sure that they look level. It's all about placement, size, everything. And I make sure that we all agree. And once we do, I mark my marks and I write it down on my paper. So when you come in for the actual procedure, we have everything ready to go. Or if you want to change something, we can go up a size. If you want to go a tad smaller, I know what to do. And I usually pick the colors too at the consult, or I'll wait till the actual appointment, just depending on how much time you have, because I do talk a lot. But, and you know, the procedure takes anywhere from, when you're actually in my room, I'd say about an hour to 2 hours tops, sometimes 2.5 if we have a lot of paperwork. But usually with the consultation, I have you guys fill out as much of the paperwork as possible so that when it's actual tattoo day, we can just go straight on towards it. So any questions so far? No?
Yeah, I have one. I do. Okay. So I've seen a lot of 3D nipple tattooing and it looks amazing, but I have not seen it on women of color. Do you have examples of that?
So I actually spoke to Leslie. I am looking for 2 women of color to be willing to let me showcase it on social media. I do have multiple women of color tattoos, but they did not opt for me to share it on social media, and I can't share it because it's private. So I do have it, but I just can't show it. So I'm looking for someone that's willing to let me show the beauty of a darker nipple.
Well,
I love it. Oh, I think
seen it. So, you can hear me now?
I can hear you now.
Oh yeah, so that's wonderful. So if that's the case, I would like to be your canvas.
Yes. So stay on after the thing and I'll give you my email and then just kind of reach out to me and we'll set up a consultation and we'll go from there.
Okay.
Are you unilateral or bilateral?
Una.
Okay, perfect. Even better. So that's great. So we'll do that.
So I don't know if you know, but I am a colleague of Leslie's. I work here at Carolina Breast Friends.
Okay, good.
So I'm the operations manager and I'm also a survivor, a 3-time survivor.
Oh,
So yeah, so definitely it's been 8 years since my reconstructive surgery, but last year 2020 I did have the deep done. So, you know, they took out implant and I'm sorry. Well, we'll talk about it afterwards, but okay, I'm willing to chat with you some more. Okay.
Yeah. So what I'll have you do is you'll come in for a consultation
Mm-hmm.
and I'll ask you all those questions because I'm nosy. I like to know those things because it
Yes.
tells me, and I like to know if you have breast implants, silicone, like whatever it is. I like to know all of that because it
Okay.
helps me on my needle selection. Do I need to go deeper? Do I need to go a bit lighter? How thin is your skin? How thick is your scars? Do you tend to keloid? So all that stuff is very important. But you'll be a
Okay.
really good candidate. So you'll be my other one for my model. So yay.
Okay, good. And I'll be able to do some show and tell here at the Pink House.
Yeah, and nobody will know it's your breast. So that's the
Okay.
that's what I tell people is you might see it somewhere, you know, but they won't you can be like, that's not breast, but they won't know, you know.
Okay. All right. Well, great. Thank you.
But I love that you're doing this because it's gonna help other people like you that are looking and can't find someone. And that's why I reach out because it's so hard to be like, hey, I do 3D areolas. Please come in, I can help you. What can I let me do what I can do for you and do this awesome service because it's hard. It's kind of frowned upon to flash your boobs on social media, right? So when you do art and you tattoo it, even though it's not a real nipple, you still sometimes get flagged for it.
Yes.
But I still risk it because that's how I get my people.
Okay.
And through word of mouth and doctor referrals and just me just throwing myself out there like, hey, come see me.
Okay. All right. Sounds good. Thank you.
Leslie should have my email address, so you can actually probably just get that from her and then
Okay.
just say, hey, it's me, blah, blah,
Okay.
blah, and then we'll get you on the calendar. Okay.
Okay. Sounds good. All right, dear. Thanks.
I think Karen Reeves has a question and also Yata has a question. So why don't we take those next?
Sure.
Right. 2 quick questions. Number 1, do you file insurance? And number 2, are touch-ups usually needed after the initial tattoo session?
Great question. So me being an independent tattoo studio, I cannot file insurance. So it's cheaper than going to a doctor's office. But I do work with some doctors where I go to their shop to tattoo and you can file it underneath their tattoo insurance. But because of COVID, they have me on hold till January. So I can't tattoo until January in their offices, which is weird. But
So what are
yeah.
your rates?
So it just kind of depends. So you'll come in for a consultation. I'll look at it. So, and typically it's about $350 a breast, but because you are referred by the Pink House, you guys do get $50 off per breast. And then sometimes
Thank you. That's great.
and you're welcome. Sometimes I might look at you guys and I'll be like, oh, this is not going to take long. You know, $70, $75 cheap. It just kind of depends, but it's usually like that's like an estimate rate. But when I see you in person, I can give you a better. Like you actually, Leslie, referred me someone. I won't say who she was, but she did come in. Thank you. And I only ended up charging her $200 per breast because there wasn't much I really needed to do for what she was looking for. So I will work with you if I need to, and make it work into the budget and make it fair because my end game here is to make everybody feel complete. It's not about how much money can I make off of this. It's about how can I keep building and building confidence and making beautiful nipples on people. I want to be known as the booby girl.
Are touch-ups required?
Anything, but and then sometimes you do need a touch up. And usually I have you, typically you heal like after, so it takes about, I'm trying to say this correctly. After your initial tattoo, it takes 7 to 10 days to heal. I like to say 7 to 14 days because I like that little buffer, because some people do heal a little bit slower. And then after that, you do the topical part heals, but your insides are still healing a little bit. So I always tell people like 6 to 10 weeks is when you want to touch up if you need it. Sometimes I'll have you go ahead and book a touch-up appointment, but you'll know like a week before if you need a touch-up or not. You can either email me privately, like, hey, can you let me know if I need a touch-up and keep my appointment or not? And I can tell you. I only charge for my material, like my supplies for a touch-up, because I can't reuse it, and that's about $100. Just so that you have that. And I would say about 75% of my clients don't need a touch-up, but there are that 25% that do. I might be like, you know what, let's push it out another 3 months, because then you're definitely going to know if you're going to fade anymore. You're not going to fade after 2 to 3 months, right? So sometimes I like to push it out a little further and then do the touch-up if you're going to spend the money to do a touch-up. Sometimes I might, depending on how it is. If it's like minor, like let's wait a little bit longer and see if it does anything else. If not, then we'll do the 6 to 10 weeks. So I try to make it as fair because I want you to get the best service possible and what benefits you the most. Yeah, hopefully I answered your question.
Okay, ladies, just unmute yourself and we'll try to do one at a time and ask them. I see more people have questions, so that's great.
This is Sarah. I've got a question. How long does it typically last?
So it is a tattoo, so it lasts. It can, so with areola tattoos, with the skin being a little bit thinner, it does fade a little bit faster, but not like, I don't know if you guys ever had PMU done like on the face. It tends to fade really, really quickly. Areolas tend to fade. The initial appointment, I would say after 2 to 3 months, it'll stop fading, but it does lighten up a little bit. It's dark at first, and then it lightens to really pretty color. But if you want it back to being bold, then we'll do a little touch up. And then after that, I probably won't see you for another 2, 3, 4, or 5 years. It is kind of up to you and how you like to keep it fresh or not. And it kind of depends on skin types. So if you're more oily and you sweat a lot and you didn't do the proper aftercare, that can affect it. But if you're doing everything I tell you to do after you leave, after your tattoo appointment, you should have good results.
Okay, thank you.
You're welcome.
I have a
It
question.
is permanent, so it's not semi-permanent.
I have a question.
Okay.
Yeah. Hello?
Hello, how are you?
Yeah, go ahead and go with your question.
I had my tattoo done 27 years ago.
Okay. Wow.
So it is completely like gone. And I was thinking about it and I'm like, it does look strange because you got one, my natural is there, but this one is now gone practically. And I'd like to get mine.
Would you like to be my second model?
Yes, I would. I did a photo shoot one time showing my left scar.
Okay.
And phenomenal, to be able to, I didn't know what a reconstructive breast would look like. So it was like, I was just like, there's no one of color that I could look at to see what reconstructive breast would look like. And I loved it. And I have my scar and I like to have something done with my scar as well, because it's just it's like a horseshoe. So
Yeah.
it's not pretty at all,
So what I would like for you to do, because you're actually someone I'm looking for that. So I've been, it's really hard to find people that, like, usually like my clients that come in, I'm like, yeah, you can post, they won't tell me. But for some reason, I've had a hard time finding people of darker skin to want to share, but I don't know why. But, so this is good because I also wanted to show someone that actually had an old tattoo and how we can refresh it and rebuild it up. So you would be a good candidate for that. So
And see, I use my own breast, my own stomach. So
yeah, so you got a stomach
Mhm.
up
My
into here.
train back.
Okay.
So I was
Yeah.
like, you can go to just a regular tattoo because they don't know what's going on inside of this space. So when I saw the your ad, I was like, oh, I need to investigate that.
Yeah. Well, I would love to have you at the end of the call share my email and my phone number, and I would love for you to email me and at least get you in for a consultation, make sure everything's good and that we can move forward. And I'd love to highlight you.
Thank you.
Oh, and just real quick while I'm thinking about it, I am offering a, this is for everyone else that are thinking about like, hey, no fair, I want a free areola tattoo. I am for October Breast Cancer Awareness Month, I am doing a contest. It's kind of like a giveaway. If you email me your breast cancer story and being willing to share it on social media, even better. But if you want to stay private, that's totally fine. I will be giving away complimentary set of areolas to the winners. I'm doing it for 2 people. So you guys are welcome to enter that as well. And you just have to email me and tell me your story, but you don't have to because I'm going to do it because I need you for advertising.
No problem. No problem. We have got to end the silence of breast cancer in our age, you know, because
Yeah.
I was before when I was diagnosed. So
Wow.
it's been a 30-year battle.
Yeah. And you're smiling and we're here. I love it.
Definitely. Definitely.
Well, I look forward to meeting you in person.
Okay.
I've got a question if this is a good time. Okay, I had breast cancer 11 years ago, and then I had tattoos done then, bilateral, and they faded right away. So now I really want to have them done again. Now I'm wondering, I'm a swimmer and I also am a swim coach. I'm in the water all the time.
That's a factor. Yeah.
So what, how long do I have to stay out of the water?
I would prefer, I know this is going to be hard. If you can stay, all right, I'm choking. Hang on. Eating crackers later. I think I'm stuck in my throat. If you can hold off swimming for at least 3 weeks and not submerge your breast, that would be ideal because you'll have the best results. Technically, you are healed after 7 to 10 to 14 days, but I don't like, even with my regular, I actually do regular tattoos as well. I don't like people just submerge their tattoos for 3 weeks because it can affect how it finished healing. Like on the inside, it can fade the color a little bit faster. Oh, and I don't like that. So if you're going to invest in areolas, if you can invest in not submerge, like you can get in the water, just don't go below your waist. You'll be okay. A little splashing's okay. Just don't completely rinse yourself, and you'll have better outcome with your areolas. And if you weren't swimming back then and they still faded, she probably didn't go deep enough, or your skin just rejected the pigment. So did you happen to go back for a touch-up?
I didn't even know the word. I didn't know that a touch-up. I just thought, oh, it didn't work, and I just moved on.
Okay. So yeah, so I'm very like, when you come in, I'm like, touch-up is important. If you don't need it, great, but let's go ahead and book it because I want you to be on my schedule if we need you. But if you don't, then I'll take you off because sometimes the payment doesn't always take, and you have to kind of go back over it and fill it in and go a little bit harder in that spot. And it might be because there might be a scar. And and I do want to disclose this, if you do have scar tissue, sometimes the pigment's a little bit harder to get in there. And sometimes you need a few more touch-ups just to get it implanted. So it's a little bit tougher in those areas. Not all the time, but it does happen. So you would be a good candidate for that because if you do submerge, not to fully go under, and I bet you would stay on a lot better. And then we'd probably go a little bit darker, a little bit more passes if your skin can handle it, just to make sure it's packed in there nice and saturated so that you have a little bit longer wear.
Great.
Can affect your tattoo, like the environment that you do.
What is are you going to give us your email address to everyone?
Yeah. I don't know if it's easier if I like have Leslie just email it to you or I kind of just shout it out, but it's pretty easy. So I'll do that at the end, but yeah.
When I send out the evaluation forms, I will also include Sissy's email. So y'all will probably get it 3 or 4 times.
Love it. And just say that you are part of the Zoom call because you guys are going to get a little extra discount. It's a surprise when you guys come in. I wasn't going to announce that, but I kind of just told on myself. Like a little extra discount for just spending the time with me and talking with me.
Thank you. That's so nice.
I have a question, and I think it's probably the same question that Laura in the chat has about the scar camouflage. Is that for those that have not had reconstruction, just had a bilateral or unilateral?
So I would have to see your scar in person because not all scars are candidates of scar camouflaging, or I might refer you for a different procedure. What it is, I have to look and make sure you're not prone to keloid. Is it a hypertrophy scar? Because those things I can't really work on until it's fully healed. But keloids I can't work on at all. So if you're prone to that or prone to infections in that area, I wouldn't be able to do it. But if it's just a regular scar and it's healing normal, I can camouflage it. Or I might test a little spot if I'm not sure and let you go on your way and then kind of reevaluate at a second consultation. So it kind of just depends, and we'll match it to your skin tone as close as we can. I just don't pick one solid color and like blend it in. I actually stipple and blend and color and kind of make it blend. But if you get darker, like say you're tanning, and I doubt that you guys are going to be tanning your breast, but if you are, your skin can get darker, but just know that whatever I tattoo is always going to be lighter. So I always like to disclose that. But
I
yeah,
have a friend that has had a double mastectomy, and she has roses going all the way from the left all the way to the right, covering both scars. So that's what I'm more interested in, something like that.
Yeah, and I do stuff like that as well. Yep. I can do like floral cover-ups. Some stuff I won't do. I'll be like, that's out of my range. Here, go to this person. But I can do bouquets. I can do a lot of different styles of tattooing, but I like to be selective on what I take. But yeah, but bouquet stuff are my favorite.
Do you have any pictures of what that might look like? Even if it's not on a person's body, but just a picture of the flowers?
Pretty sure. I mean, I can customize it. Like I can draw different types of flowers. If they go on Pinterest and find like, oh, I really like this, I can do it. Just have them email it to me and I can go from there. But if you go on my Instagram, Hello Gorgeous Ink, INK on Instagram, I'm pretty sure she's still on there. There's a girl that has this here. She had a radiation scar right here. And this is the stencil I drew. And this is just showing that I do custom stencils for tattooing to cover up scars. And in that Instagram post, you can actually see her tattoo as well. Like what I did. It looks really good. It's a good video, so you'll have to watch it, unfortunately. But it's a good video. Any other questions?
I had a question about aftercare exercising and things like that. So what I know that, I kind of gotten the idea that you don't like it to get too sweaty or wet or whatever, but can you run after or how long do you have to wait or, stuff like that?
So I go through like an extensive aftercare with you at the appointment. But what it is you can't wear tight fitted clothes because you don't want anything to run. You're going to cleanse it daily with antibacterial soap, and you're going to keep it moisturized because we don't want it to dry and flake off. And then that's when you tend to lose most of your pigments. I do not like for you to sweat for 7 to 14 days. You can do light sweating, but if you're going to go run a marathon, I'd rather you wait till 14 days or later. But as long as you're not fully submerging your tattoo area into water, like hot jacuzzis or anything like that, you're good. I do recommend tempered water, not super, super hot water, because it can affect bacteria growth and we don't want any kind of infection happening. So tempered water, pat dry when you get out of the shower, moisturize and clean, all that fun stuff. And same thing, no rubbing, picking or scratching the tattooed area. And try not to be hot. Like when you're cooking, like if the steam's coming, try to step back a little bit because I don't want you to sweat too much in those first 7 to 14 days. I'm just very particular. I mean, obviously it's not that much. You don't have to baby it as extreme as I'm making it sound, but I do like for you guys to be as cautious as possible because your results will be way better if you treat it like little infants. Like can't hurt it. But yeah, you can work out. Like my one client, she's a hot yoga instructor and she's gonna sweat. So I told her after 14 days, she's fine. And she goes, what about my little mini workouts? I can't get out of shape. So I said, if you feel like you're starting to sweat, stop, pat dry, cleanse the area, moisturize, wait 10 minutes, and then you can start it again if you have to. Just know your limits and kind of recognize what your body's doing so you don't kind of overdo it. Yeah. Oh, and just make sure before appointment, this is something that made me kind of think about it. No antibiotics or like steroid medication before your appointment. And I do go over that in the consultation because it can affect the tattoo color. And I do recommend if you get any kind of vaccines or shots to wait 2 to 3 weeks before getting the areola. So that's something I do like to disclose as well.
How quickly can someone shower after having this done?
Same day.
Same day. Okay.
Same day. I actually make you guys shower the same day. I'll put Tegaderm on you. It's like a sticky Band-Aid. You'll take it off. You'll let the water kind of run down you, not super hot, tepid water. Let it rinse, and then you can do light antibacterial soap, clean the area, get out, pat dry, put a little bit of moisturizer on there. And you can rebandage them up for the rest of the day for 24 hours if you want, or just let it air dry and keep it moisturized. Just don't wear really tight clothes.
Okay.
Hi, Sissy. I have a question. My name is Sharon, not Belle, Sharon Zajac, and I facilitate the triple neg breast cancer group. So I will pass your information along when we have meetings for those that are interested in the tattooing.
Oh, thank you.
You're welcome. I had a bilateral 6 years ago and had the nipple reconstruction with the areola and the actual nipple. And it's very light right now. Over time, it's become much more lighter, the areola and stuff. So I've been on the fence about this. So I'm thank you for presenting the group because I think mine would be a simple one just because I have the shape of the areola already.
Yeah.
It's just would be making it darker, so to speak.
So they tattooed you already. It just faded. Or did they
Yeah.
actually?
Yeah, it was darker when he did the areola. He did skin grafting and stuff, and it was darker at first, and then over time it just lightened up.
Yeah.
It
So
feels much lighter.
the tattoos can fade. So I do want to say that it can fade and it can get a little bit softer through time. So it's like I have like a regular tattoo on my foot and it's full, but through time it starts getting lighter, right? So every once in a while you have to go, okay, I probably need to refresh this tattoo. It's kind of the same thing with your areolas, but you don't have to do it as frequently as you do like your microblading or things like that.
Right.
So
right. Okay. Well, thank you. You do other tattoos. I heard you do other tattoos besides.
Yeah, I do eyebrows, eyeliner, lips, areolas, paramedical tattooing. I do fine line tattoos, tiny tattoos, like flowery stuff, like customized tattoos. Yeah.
Okay. Awesome. Well, thank you. Thank you. I'll get your information.
Ladies, I want to make sure you understood what she just said. Permanent makeup, eyebrows, eyeliner, lips.
Yep.
So be sure to keep that in mind as well.
Yeah.
Leslie, your dog is so cute.
She typically joins these Zoom presentations. She's highly educated.
She's just chilling. She's so cute. Yeah. But yeah, so yeah, I would say, I'm trying to think, I'll make sure I went over through everything. Not everyone is a candidate of 3D areola tattoos. That's why I actually offer consultations. Like I never want to just book straight to the tattoo appointment. A lot of people want to just rush and like, can I just do it all the same day? And I say no, because I don't want you to get your hopes up if I can't do it. And some of the factors would be you haven't healed long enough. Your scar is still a little too pink. You might need a little bit more time. It may not be a yes right now or a no forever. It's just not right now, right? History of infection in the area that's being tattooed. If you keep having issues of healing, we obviously need to wait a little bit longer, and we might need to get a consent from the doctor that it's okay to move forward with the tattoo. So I would have to get a doctor's approval. Severe damage due to radiation of the skin, that's a factor too. Or we might have to look at it and see what else we can do with that area. The breast skin being too thin because they didn't heal properly, and you can usually tell, or I might have to skip that area a little bit and tattoo around the thin part of the skin. So there are some factors that can kind of affect the tattoo a little bit. So that's why that consult's so important. And I don't let people just skip it and jump right into the same day, like consultation / roll into the tattoo appointment, because I want to make sure that you understand what you're about to do, and that I answer any other questions that you have, and I can make sure and understand what you're trying to achieve with your breast as well. So there's some things to kind of think about as well. Yeah. And then, so some people, when they get transfers, like different type of, can't think of the word, flaps, like different, when they take tissue and move it from one body to the other, sometimes your tissue dies. You can still get tattooed. It does require a little bit more of advanced technique, and it can cost a little bit more. So that's also why when I have you guys come, so I need to turn this off really quick. Bubbly. I didn't realize that was still on. Okay, we're good. So you can still get your 3D areola tattoos when your skin kind of dies in a little bit of a few areas. It just takes a little bit of a technique, and it could take multiple sessions to get it saturated enough. So I do like to disclose that as well. So the consultation appointment is really important to get to know what I'm looking at and prepare for that appointment. Yeah. Does anyone have that happen to them? I'm just curious. I've only had maybe like 12 clients in my career so far that's had that. So it's not very common, but it does happen. And their retention was good too, which is impressive.
Where are you located?
I am located in Matthews, North Carolina, off of Samuel.
Great, thank you.
You're welcome. That was an easy question.
Who else has questions? Sissy, you're doing a great job. You're explaining everything so well.
Good. I've seen rambles. I'm very good at rambling. So if I am, just cut me off. My husband yells at me all the time.
I was interested when you were telling me when you came to the Pink House that your sterile technique, that obviously you use brand new needles on everyone. You never reuse your needles. So maybe you might want to mention that.
Yeah, so the state of North Carolina right now does not require tattoo artists to be blood-borne pathogen certified. I take it upon myself to be certified because I want to treat everyone as the same, right? We don't want any diseases. We don't want to transfer anything. Microorganisms are everywhere. We don't want to get anything infected. And I want to protect my work as well as protect you. I don't want you to get sick off of what I did, right? So everything I use is sterile and individually packaged. I wish I had a needle out of there. Everything's individually packaged, the needles, and I will actually have you hold that needle, look at it, examine it, and make sure that it's not been open. And if you agree that it has not been used, you initial it, and then watch me open it. Like, I don't just have it pre-open on the table because I don't want you to think that we're dirty here. We're very sterile. We are also a hair salon out in the front, but I have like a little private room. I'll just kind of show you. Like, no one can see. I also teach, so I have a chalkboard if you all saw it, but yeah. But so we're very sterile, no hairs in here. Like, I'm very particular, especially when it's clinic day, when I'm tattooing on my breast cancer survivors. I messed up my lighting. All of our disposables get tossed once they're soiled. If I drop something, it stays on the floor until I'm done because I'm not going to grab it and then touch your face because that'd be gross, right? So everything is clean. So just know that you're in a safe place and we're not some like crazy tattoo studio where you're like, where am I at? I'm gonna get cuties here. But no, I don't really see any tattoo studios around here that do that. But you know, you're gonna feel clean. You're gonna feel safe. You're not gonna feel like you're gonna get something by walking in here. So I take pride in that. And my hairstylists out there, they pick on me. They're like, they call me the OCD queen. I'm like, there's a hair right here. Can you get it? They'll wipe it down. But they love me. But you gotta be OCD, right? Especially when you're dealing with blood. You know, you don't want to wipe your face. And I tell you what, every time I'm tattooing, it never fails. I itch and I'm like, scratch that for me or touch me. Because I can't, you know?
Yeah.
So it never fails. It's so funny. But yeah, I love it. It's definitely rewarding. I wish I would have discovered this service many, many years ago, but you know, better late than never, right?
Right. Karen Reeves was asking about the eyebrow microblading. She's wondering the cost of that and can that be done at the same time as the nipple tattoos?
Yeah, so you can do any kind of, I don't like to overstress the body, so let me go and say in that. So if I do your areolas and you feel clammy and you feel a little faint, I'm obviously not going to continue with the microblading, but if you feel fine, I'll keep going. But if I feel like your blood sugar is dropping or things like that, we'll take a step back and reschedule that. But you can definitely reschedule. Microblading kind of depends on what you're looking for. I do what's called blade and shade, which is microblading, microfeathering strokes, and machine shading. Microblading just the microfeathering strokes, and then just shading. So the prices can kind of differ. I break it up between the initial appointment and the touch-ups. So again, I do have you guys come in for a consultation and we kind of go from there, but it can start anywhere from $450 and up, plus $150 for a touch-up. But if you say the Pink House or a Zoom call or anything like that, you will get a discount. So just keep that in mind. You're like, you said I get a discount. And remind you, like, yeah, you can. But, and I would obviously like to know, like if you come in for your consultation for your areolas, we can do the same consultation for any kind of PMU service that you're thinking about too. So we can lump it in. Just let me know beforehand so that I block enough time on my schedule. Oh, my hours. This is the question I get a lot from people. I am by appointment only. I do not take walk-ins, but I'm very flexible. I do try to keep at least 1 to 2 days off for just myself, and then I'll just stack the rest of my days. My days off fluctuate because my client schedules fluctuate, so I try to make it work as much as I can. And I only stay late 3 days out of the week. So, but I come in as early as 6 a.m. So I'm very flexible. Yeah. And then I usually leave here about 5 p.m. typically. Now, if I'm working at a doctor's office, I'm on their hours and I call that clinic days. Sometimes I'm there 2 to 5 times out of the month. It just kind of depends. Sometimes once a week, but because lovely COVID happened, it's been a little bit more relaxed there. They said hopefully January things will be back to normal, but I love it.
A question.
Yes, go Shar.
I know it's, I'm a character by nature. So, I always think outside, Leslie, I'm always thinking.
Oh my.
So, so I'm interested also in the microblading of the eyebrows. But however, I always have nightmares that one will be higher than the other. How do you correct something like that? But I don't think that, you will, have that oops happen.
Yeah. So we do like everybody's gonna tell you we face map, right? We all face map, we do our measurements, we draw our shape in, we make you look at it. But what they don't do is I'm like, smile, make an angry face. Try to wiggle your brows, give me a sad face, because I'm looking at your muscles.
Okay.
Because what happens is sometimes you have a more dominant muscle, and when you microblade, if you're not counting that into effect, they can look slightly off. So I look at that too when I'm mapping you, because I'm trying to fit that in. But I also don't do what I call it Instagram brows, where they're really bold and look like Sharpies. I don't do those type of brows. So if that's what you're looking for, I'm not your artist.
Okay,
But if you want natural that look like they belong to you brows, I'm your person.
gotcha. That's
But-
the look I'm looking for. Okay.
And if we can't agree on a shape, I will not force you to get the tattoo. I'll say maybe wear this for now and come back when you think you're ready. Because I've only had like a couple clients that will come and like they couldn't decide on a shape because they're used to their pencil drawing. And then when you kind
Yes.
of add them a little bit, they got a little nervous. If I sense that, I will be like, I would love to tattoo today, but let's let you wear this and then come back. And they come back and they're like, all right, I'm ready. And then they're like, go for it and they love it.
Okay.
So I'll never make you guys feel pressured, but you have to, and I don't want you to feel pressured because you're worried about wasting my time. It's your
Okay.
face.
Uh-huh.
So I'm on your time. So, but
Okay.
but as long as you're comfortable, I'm comfortable, and we will color match you and things like that. Microblading does take a couple of sessions,
Oh.
sometimes 2 to 3 sessions to get it right.
Okay.
It could be many factors, oily skin, certain medications that you're on, things that you're putting on your face. There's so many factors.
Okay.
So your face is going to take to the pigment. So I do like to
Gotcha.
disclose it with the consultation too.
Okay. Thank you.
I'm trying to think if I went through everything. Okay. I think I did. I made me a little cheat highlight board over here just so I can make sure I went over everything because it's a lot of information to go through. And I feel like we went through everything, and just so that this a reminder of what to expect with the 3D areola tattoos is that it does take about 1 to 2 hours to do the actual service. We do shape, color, placements, and we also consult to make sure you're happy with it before we actually do it. So if you're on the fence, you're not really sure, you have until I actually tattoo you to back out. So don't feel freaked out. I always go, I'm about to tattoo you. Are you ready to move forward? If they say yes, then I go forward. So don't stress because it can be scary getting tattooed, especially in a part of you that's so sentimental, but it's also very rewarding for me to be able to do that. And then you guys end up loving it.
Well, and Sissy, the thing that I'm so impressed with, it's obvious that you've had a lot of education, a lot of training, and I can also feel your passion about what you do. And you're just very experienced and very knowledgeable. And I noticed that the first time we talked, and I'm even more impressed today. You've done a beautiful job with this presentation. So ladies, I want to ask if there are any more questions. And I also want to remind you that if you email Sissy with your breast cancer story, you'll be included in a drawing for the giving. She's going to give away a pair of areolas, 3D nipple areolas to 2 survivors.
Yeah. So if you're unilateral, it'd be the one. But if you're it doesn't matter if you're uni or bilateral. It's whoever wins.
No, I'm on a Zoom call. Can I call you back?
Oh, yeah, sure.
Yeah. But and the drawing is going to happen on October 15th. So you have to the 15th at midnight.
Wow.
To get your stories in. So technically the drawing's happening on Thursday, but I want to be able to read it all, and then we're going to do a random drawing because it just helps me like connect with everyone and just take in all those feelings and what they went through, and then know that I'm in a place to be able and where I'm supposed to be to help give back the way I can. So that's why I say I want to hear your stories. It's mainly that, not just enter. Like I want to know you. Like tell me about yourself. So and then
That is great. And I'm going to include your email tonight. I'm going to send out the evaluation, and I'll include your email. So ladies, you can email Sissy back and before the 15th and be enrolled in that drawing. And Laura, one of our survivors on the call, said this has been so informative. She's really learned a lot. So she wanted to thank you for doing this today. Anybody else have one more question?
Yeah.
I think Kim does. Kim?
Oh, no, I was just clapping. It was
Oh,
excellent.
clapping.
And
That's so-
just one more thing while I'm thinking about it, kind of lost my train of thought. As you're sitting there soaking with the pigment while you're getting your tattoo, you will see I'm starting to clean down my area and stuff because I want you to know that the room is clean. So you'll see that when I do your tattoos and stuff. I'm very OCD with that. I'm like, "Oh, gotta clean this, gotta do this while you're studying, and then I show you everything. So you'll know that everything is clean. And I do that with everything that I do. If it's lash extensions or whatever, when I'm done, I make you guys see me washing my tweezers because I don't want anyone to ever think that when they come in here something's dirty. Like that's like my fear. It's
Good
not.
to
I
know.
actually have a couple of people that work for OSHA that come to me and they refer me. So I'm like, that's a good sign if OSHA comes. So yeah, but I've been so excited to be a part of this today. And if you guys decide later that you have questions, email me, text me. I'm here. Follow me on Instagram. I'm really bad about posting on Instagram. I'm trying to be better. Working on it. Well, because I'm old school. It was word of mouth. Now it's like be in front of the camera, post this, post that. So doing that now. But
You do a great job.
But yeah, and then so it's hellogorgeousnc@yahoo.com. But Leslie will give you guys that at the end, okay?
I am. Thank you so much, Sissy. This has been wonderful.